My name is Dr Bob Ryder from Birmingham in the United Kingdom, and I'm presenting here data from our experience with EndoBarrier treatment in Birmingham, specifically with regard to renal function. These are my disclosures, and this is a picture of an EndoBarrier, a 60 centimetre impermeable sleeve which is implanted during a simple endoscopy procedure into the first part of the small intestine, such that the food passes through it rather than touching the walls of the small intestine, and it mimics the bypass bit of the Roux-en-Y bariatric surgical procedure. Our aim was, as the risk of progressive kidney disease is increased in individuals with very high BMI, we wanted to assess the impact of EndoBarrier-induced weight loss on renal function in patients with advanced diabetes. Our experience with EndoBarrier in Birmingham was through two research studies, both sponsored by the Association of British Clinical Diabetologists, and one of them, our EndoBarrier in Diabetes with Obstructive Sleep Apnea study, is the subject of ePoster 2015P at this meeting. In 2014, we established an NHS service, and we have data on 89 consecutive EndoBarrier treated patients in Birmingham with diabetes and obesity, and the outcomes were monitored in a registry. And this is the baseline characteristics of our 89 patients, and in particular, I'd like to draw your attention to the fact that they were very obese with a BMI of 41.3, poorly controlled with a hemoglobin A1C of 9.4%. They'd had diabetes for a long time with a median duration of diabetes of 10.8 years, and over half of them were taking insulin. And this is what happened with the year of EndoBarrier treatment. They lost 15 kilograms of weight, hemoglobin A1C fell from 9.4% to 7.5%, and systolic blood pressure improved from 138.4 to 126.3 millimeters of mercury. And this is what happened to the renal function. There was an improvement with the serum creatinine dropping from 88.9 to 83.9, and the EGFR increasing from 83.6 to 90.1, both highly significant improvements. 8 of our patients prior to EndoBarrier had a raised serum creatinine, and in 6 of these, the creatinine reduced with EndoBarrier treatment, and in 3, it actually went to normal. And we noticed that in those with an improvement or normalization of serum creatinine, there was a big weight loss, whereas in those without improvement, the weight loss was only 6 kilograms. So it's 17.3 kilograms in those with the big improvement and 6 kilograms in those without the improvement. And this is one of our patients, and you can see that in association with EndoBarrier treatment, she lost 19.4 kilograms. Her hemoglobin A1C dropped from 8.5% to 6.7%. Prior to EndoBarrier, she required 147 units of insulin, and after the EndoBarrier, insulin was no longer required. And you can see there the markers of renal function. She had a raised serum creatinine at 153, which dropped to normal at 106 micromoles per litre, and the EGFR went from 30 to 46. And this is another such patient, and you look at the colossal amount of insulin he was requiring prior to EndoBarrier, 560 units daily, and even despite that, his hemoglobin A1C was 10.2%. He lost 20.7 kilograms. The hemoglobin A1C dropped to 7.7%. His insulin requirement dropped from 560 to 140 units, and you can see the big improvements in creatinine from 348 to 281, and EGFR improving from 16 to 20. So in conclusion, as well as previously documented improvements in weight, hemoglobin A1C, blood pressure, EndoBarrier treatment was associated with an improvement in renal function. These observational findings warrant further investigation.